Most people spend a third of their entire lives in bed and never once think about whether the position they sleep in is slowly damaging their heart. Tonight, that changes. What I'm about to tell you is something I wish had been taught in every cardiology textbook I ever read. Because the research has been sitting there for years, quiet, largely unread outside the specialist community, while people have been sleeping in positions that add unnecessary strain on the one organ they cannot afford to ignore. My name is Dr. Eleanor Voss. I'm an interventional cardiologist with 24 years of clinical practice, and for the last 9 of those years, I've been running a cardiovascular research unit at a university hospital where we look specifically at lifestyle factors, the ones patients control every single day, and how they interact with heart disease, clot formation, and stroke risk. I've reviewed thousands of patient histories. I've stood in rooms where families were told their loved one had a stroke overnight, in their sleep, with no warning they recognized. And over again, I kept asking the same question nobody seemed to be asking. What were they doing in the hours before? Pause. One case stayed with me, still does. A 53-year-old woman, healthy weight, non-smoker, walked 4 times a week, came in after a transient ischemic attack, a mini-stroke. She was confused, terrified, and completely convinced her lifestyle had been protective enough. And in most ways, it had been. But when we went through her history, something kept coming up that nobody had flagged. She slept exclusively on her right side, had for decades, said it was just the most comfortable position. That was it. That small detail. It didn't cause her TIA alone, but it was part of a pattern we were beginning to understand much better than the general public, or even most general practitioners, realized. I want to talk to you about that pattern today. Here's what almost nobody understands about sleep. Your body doesn't just rest when you close your eyes. Your cardiovascular system is actively working. Your lymphatic system is clearing metabolic waste. Your blood pressure cycles through natural dips and climbs, and your heart, depending on how you're positioned, is either working efficiently or working against gravity, against compression, against its own optimal geometry. The position of your body during those 6, 7, 8 hours of sleep determines a great deal more than how your neck feels in the morning. Let's start with something that might surprise you. When most people think about heart health during sleep, they think about apnea. They think about snoring. Maybe they think about not eating too late. What they almost never think about is the physical orientation of the heart inside the chest cavity, and what gravity does to it for hours while you lie still. I always explain it to patients this way. Imagine the heart as a pump sitting inside a slightly tilted chamber. The position of that chamber determines how hard the pump has to work. Tilt it one way and everything flows easily. Tilt it the other and the pump strains just slightly. Not enough to feel it in the moment, but enough that over years, over decades, the strain accumulates. Research published in the European Heart Journal found that people who sleep consistently on their left side show more efficient cardiac output during sleep than those who sleep on their right. The reason is anatomical. The heart sits slightly left of center in the chest. When you lie on your left side, gravity pulls the heart gently toward the chest wall in a way that actually reduces the work the left ventricle, the main pumping chamber, has to do. The aorta, the largest artery in the body, descends slightly downward in that position, allowing blood to move more naturally through the circulatory system. Sleeping on your right side, by contrast, does the opposite. The heart shifts position in a way that can increase the mechanical load on the left ventricle. Not dramatically, not in a way you'd feel after one night, but consistently, night after night, year after year. Think of it like water flowing downhill versus being pumped uphill. The heart is always working. The question is whether you're making that work easier or harder while you're unconscious and have no control over it. For people with existing cardiac conditions, weakened heart muscle, hypertension, early-stage heart failure, this distinction becomes critical. A 2018 meta-analysis in the Journal of the American College of Cardiology found that patients with congestive heart failure reported significantly worse symptoms and poorer sleep quality when sleeping on their right side compared to their left. Their hearts were literally laboring more. And here's what gets me. These same patients were never told this. Not by their cardiologists, not by their GPs, not by anyone. They were told to reduce sodium. They were told to take their medications. Nobody told them to roll over. But the heart isn't the only system that benefits. And this is where I need you to stay with me, because what comes next is something most people have never connected to sleep position: thrombosis, blood clots. Before you skip past that word, I want you to understand what it actually means for the person lying in bed right now who doesn't know they're at risk. A deep vein thrombosis, a clot that forms in the deep veins of the leg or pelvis, can sit silent for days, weeks. You might feel a dull, heavy ache in your calf that you dismiss as a pulled muscle, a slight warmth behind the knee that you don't mention to anyone. And then, without warning, that clot breaks free, travels to the lungs, and becomes a pulmonary embolism, an emergency, sometimes fatal. The CDC estimates that between 60,000 and 100,000 Americans die from venous thromboembolism every year. Most of them had no idea they were in danger. Here's what sleep position has to do with it. When you sleep on your right side for extended periods, particularly if you sleep with your legs slightly bent upward or in a curved fetal position, the compression patterns on the vascular structures of the left leg, and to a lesser degree, the pelvic veins, change. Research from the Thrombosis and Hemostasis Journal has documented that certain positional compressions during sleep can slow venous return from the lower extremities. Slow blood flow, particularly in someone with any clotting tendency, is one of the 3 core factors in Virchow's triad, the classic model for clot formation. I always tell patients, stagnant blood is dangerous blood. Think of it like a river. When the river flows freely, sediment moves with it. When you dam it, even partially, even temporarily, that sediment settles. And once it settles, it starts to build. Left side sleeping, by contrast, reduces this compression on the vascular pathways. Blood returns more freely from the lower body. And there's an additional benefit that many researchers believe is significant. The inferior vena cava, the large vein that returns blood from the lower body back to the heart, sits just slightly to the right of the spine. When you sleep on your left, you take pressure off that vessel. Blood flows back to the heart more efficiently, with less resistance. Less resistance means less stagnation. Less stagnation means lower clot risk. This is especially critical during the late night hours, somewhere between 2 and 4 a.m., when blood pressure naturally dips to its lowest point and circulation slows. If you are prone to clotting, that quiet window is when the risk quietly peaks. And you are asleep. You are not aware it is happening. Now, stroke. I want to be careful here because I know that word lands differently for different people in this audience. Some of you have had one. Some of you watched a parent have one. Some of you are worried because you felt things, fleeting dizziness, a strange visual disturbance, a moment of confused thinking, that you filed away and didn't mention to anyone. I hear you, and I want you to pay close attention to what I'm about to say. One of the lesser-known contributors to ischemic stroke risk, the kind caused by a blocked artery, which accounts for roughly 87% of all strokes according to the American Stroke Association, is the nocturnal accumulation of metabolic waste in the brain's glymphatic system. The glymphatic system. Most people have never heard of this. It's essentially the brain's waste clearance network, a system of channels along the brain's blood vessels that opens up primarily during sleep and flushes out metabolic byproducts, including beta-amyloid and tau proteins associated with neurodegenerative disease and other inflammatory compounds that can contribute to arterial damage over time. Here's the part that matters for sleep position. Research from the University of Rochester, published in the Journal of Neuroscience, found that the glymphatic system functions most efficiently in the lateral sleeping position, meaning on your side, compared to sleeping on your back or stomach. And between left side and right side lateral sleeping, preliminary findings suggest left side may have a slight additional advantage, likely related to the reduced cardiac workload and more efficient venous return, allowing better cerebral perfusion. What this means in plain language: when you sleep on your left side, your brain has a better chance to clean itself. The best analogy I have is a dishwasher that only runs on a specific cycle. If you interrupt that cycle, if the water pressure is lower, if the drain is partially blocked, the dishes don't get fully clean. Night after night, the residue builds. And in the brain, built-up inflammatory residue is not abstract. It is a measurable risk factor for vascular damage that can culminate years later in a stroke. Let me pause on that for a moment, because I think it deserves to land properly. Your brain has a nightly cleaning cycle. The position you sleep in either supports that cycle or works against it. And most people have never been told this. Not once. I want to ask you something directly, and I genuinely mean this. Have you ever woken up at 3 in the morning with your heart pounding? Not racing, just pounding, heavier than usual. And you lay there in the dark trying to decide if it was something or nothing. If you have, type yes in the comments. I read these. And I want to know because that specific experience, the heavy nighttime heartbeat, is more common than people realize. And for some people, it's directly related to position-induced cardiac workload changes during sleep. It doesn't mean you're in crisis, but it does mean your body is communicating something worth understanding. Now, I want to address something that comes up every time I discuss this in a clinical setting. What about back sleeping? What about stomach sleeping? Back sleeping, supine position, has its own set of issues, particularly for anyone with any form of sleep-disordered breathing. The tongue and soft palate fall backward under gravity, narrowing the airway. Even in people without diagnosed apnea, this can cause microarousals, brief interruptions in breathing, and drops in blood oxygen saturation that the cardiovascular system registers as stress events. Repeated nightly stress events have cumulative effects on blood pressure and arterial inflammation. A landmark study published in JAMA Internal Medicine found that even subclinical sleep-disordered breathing, the kind people don't know they have, was independently associated with a 34% increased risk of stroke. 34%. From something most people would never identify as a risk factor. Stomach sleeping adds spinal strain and rotates the neck to one side for hours, which can affect vertebral artery flow, the arteries that supply the back of the brain, including structures critical to balance, coordination, and basic function. I'm not saying stomach sleeping causes strokes, but I am saying that when you chronically rotate your neck to the same side every night for years, you are adding a compression pattern to arterial flow that has no benefit and carries some risk. Left side sleeping threads the needle between all of these concerns. It keeps the airway more naturally open than back sleeping. It avoids the neck rotation of stomach sleeping. It offloads the cardiac workload. It supports lymphatic clearance. It reduces vascular compression on clot formation pathways. It is, by almost every cardiovascular metric we have, the optimal position. But here's what I want you to understand about making this change, because this is where most health information fails people. Changing your sleep position is not like changing a habit during the day when you're conscious and in control. It's something that happens in your sleep, literally. And telling someone to just roll over when their body has been trained for 20 years to fall asleep on their right side is like telling someone to change their dominant hand. So here's what I actually recommend to patients who want to make this shift. Start by placing a firm body pillow along your right side, between you and the edge of the bed or behind your back. This creates a physical barrier that makes rolling onto your right side unconsciously during sleep more difficult. Your body, in the early stages of sleep, will encounter that resistance and often stay put. It takes most people between 2 and 3 weeks to begin naturally defaulting to the left side position. If you have shoulder discomfort on your left side, which is the most common complaint, a slightly thicker pillow between your knees can realign your hip and spinal position in a way that takes pressure off the shoulder joint and makes the position genuinely comfortable. If you have significant acid reflux, left side sleeping has an additional benefit. It positions the stomach below the esophageal junction, reducing nighttime reflux events. This is documented and consistent. And since chronic acid reflux causes inflammatory damage to the esophageal lining, which can influence vagal nerve activity, which in turn affects heart rhythm, this is not a minor side note. It's another piece of the same picture. There's one more thing I want to address, and this one is the one I wish more people asked me about. What about people who already have a history of cardiac events? People who've had a heart attack, or a prior stroke, or who have been diagnosed with atrial fibrillation. For these patients, the recommendation is even more specific. For AF patients in particular, atrial fibrillation, where the heart's upper chambers beat chaotically and irregularly, sleep position has been studied with increasing interest. Research published in Heart Rhythm found that a significant percentage of AF patients report that their symptoms, the irregular heartbeat, the fluttering, the uncomfortable pounding in the chest, were worse when sleeping on the left side, precisely because the heart is physically closer to the chest wall and the patient can feel its movement more acutely. I want to be honest about that because I refuse to oversimplify. For AF patients specifically, the sensation of the heart beating more noticeably on the left side can cause anxiety that, paradoxically, worsens the arrhythmia. In those cases, a modified left tilt position, not fully lateral but slightly inclined toward the left with pillow support, can preserve most of the cardiovascular benefits while reducing the sensory discomfort. If you have an existing cardiac diagnosis, this is not a conversation to have with a YouTube video. It is a conversation to take to your cardiologist and say, I want to talk about sleep position. I want to know what the research says for someone with my specific condition. Push for that conversation. You deserve a specific answer, not a generic one. Remember the woman I told you about at the beginning? The 53-year-old who had the TIA? We didn't just treat her event. We reviewed her entire daily pattern. Sleep, position, hydration before bed, which affects blood viscosity, morning medication timing relative to blood pressure cycling. She made adjustments, some medical, some behavioral. One of them was sleep position. 3 years later, she has had no further events. That's not a miracle. That's information being applied where it should have been applied years earlier. And when she came in for her last follow-up, she said something I've thought about since. She said, I just didn't know. Nobody told me. She wasn't angry. She was just quietly stunned that something so simple had been sitting outside her awareness for so long. That's the part that stays with me, not the clinical outcome. The quiet, stunned realization that simple, available information can change the trajectory of someone's health, and it just wasn't shared with them. Tonight, before you go to sleep, I want you to try one thing. Just one. Lie on your left side. Put a pillow behind you if you need the support. Give your heart the geometry it was designed to work best in. Give your brain the position that lets its cleaning system run properly. Give your veins the drainage path that keeps blood moving the way it should. One night is not going to undo decades, but every night it compounds. And if you have someone in your life, a parent, a partner, a friend with a heart condition, or high blood pressure, or a history of clotting, please share this video with them. Don't just forward it. Tell them why. Tell them that something as simple as which side they sleep on might matter more than they think. Because the honest truth is this. Most of what protects us isn't dramatic. It isn't surgery or medication or a single heroic intervention. It's the small, consistent, unglamorous choices we make when nobody is watching, including the ones we make in the dark, in the quiet, in the hours when we think nothing is happening. Something is always happening. Make sure it's working for you.